Okay, this morning I will present about the high quality CPR. The high quality CPR is the primary component in influencing survival of from cardiac arrest. To save more life, healthcare provider must be competent in delivering high quality CPR, and the patient care team must be coordinated and competent working together effectively. It's mean CPR is doing in the group. So the critical component for high quality CPR first is minimize interruption in the chest compression. Then provide compression of adequate rate and depth. The compression rate is about 100 to 120 per minute. Compression depth is about 2 inch in adult and at least 1/3 of dimension of the chest in infant and children. Then avoid leaning between the compression, avoid the excessive ventilation. Can give time for chest to expand. So CPR in adult, first we have to look for danger, then check for responsiveness, check for heart, check for airway, breathing, circulation, and then do the defibrillation if available. Danger, make sure you check the victim and bystander are safe, wear PPE if available, look for any blood spill, sharp electric wire or unsteady bed trolley. Then responsive, check for the victim response, like you ask the patient if he is alright or not, check his response, leave him at the position which you find him, provide there is no further danger. Try to find out what's wrong with him, get help if needed, reassess regularly. Then shout for help, you can call the ambulance, then activate the ERS, emergency responsive system. Shout emergency, then bring the resuscitation trolley and defib. For healthcare provider can look for no breathing or only gasping almost simultaneously before activating the ERS. Then check for airway. We do the head tilt chin lift position. Tilt the head and lift the chin. Lift the chin. Then jaw thrust if suspected cervical injury. Then check for the breathing. Look for the chest expansion. Check if asymmetrical expansion of the chest. Send for AED if available, and then check for the chest compression. Start for chest compression. The location is the lower half of the sternum, center to the chest. So the healthcare provider will sit by the side of the victim, and then put the hand at the center of the chest. Place the heel of your hand on top of the hand. Interlock your fingers and ensure the pressure is not applied over the victim's ribs. Keep your arm straight. Do not apply any pressure over the upper abdomen or the bottom end of the bony sternum. Position your shoulder vertically above the victim, chest and press down. This is the example of the position for the chest compression. So for high quality CPR, as I said before, minimize interruption for the rate 100 to 120 per minute, depth like 2 inch in adult and 1/3 in kids. Give time for chest to recoil to expand back. So for rescue breath, do the compression to ventilation ratio 30:2. If the bag for ventilation is available. So position yourself directly above the victim head. Place the mask on the victim face using the bridge of the nose as the guide for correct position. Use the EC clamp position to hold the mask in place while you lift the jaw to hold the airway to open. Perform the head tilt. Use the thumb and index finger of one hand to make a C on the side of the mask and press the edge of the mask to the face. Use the remaining finger to take angle of the jaw. The three fingers form an E shape. Squeeze the bag to give the breath 1 second each while watching for the chest rise. Mouth to mask ventilation. Position yourself at the victim side. Place the mask on the victim face and seal the mask against the face. Place index finger and thumb along the edge of the mask, remaining finger along the bony margin of the jaw, and perform head tilt chin lift to open the airway. While you lift the jaw, press firmly and completely around the outside edge of the mask to seal the mask against the face. Deliver air over 1 second. Look for victim chest rise. So then, mouth to mouth rescue breath. Pinch the part of the nose using the index finger and thumb. Allow mouth to open but maintain the chin lift. Take a normal breath and place your lip around the mouth, making sure that you have a good seal. Blow steadily into the mouth while watching for the chest to raise, taking about 1 second as in normal breathing. This is an effective rescue breath. Maintaining head tilt and chin lift. Take your mouth away from the victim and watch the chest to fall and air to come out. Then take another normal breath. Then do the breathing mouth to mouth again for total 2 effective rescue breathing. Do not interrupt compression by more than 10 seconds. Then return to the chest compression. During delivery of rescue breath, avoid the hyperventilation. The ventilation is over 1 second till there is a visible chest rise. This will improve the venous return. If you are untrained or unable to do rescue breath, give chest compression only or CPR. Continue for the rate for 100 to 120 per minute. Then for defibrillation, if available, so this machine will bring some place like supermarket. I think should have this. So we just need to follow the instruction from the machine and put the electrode pad on the victim. Then just follow the instruction from the machine, and before the shock, to ensure nobody is touching the victim then usually we shout, "I clear, you clear, and everyone clear." Then we push the button for the shock. Then immediately restart CPR with same ratio 30:2. Continue if the shock is. If no shock advice, continue to CPR. And then if the patient breathing normal, then put in recovery position. Then put in recovery position, you must make sure the patient is safe. Remove anything dangerous from the patient, and then place the arm nearest to your right angle its body, elbow bent to the hand and palm up. Bring the far arm across the chest and hold the back of the hand against the victim cheek nearest to you. With your other hand, grab the leg, put the leg above the knee and put it up, keeping the foot on the ground. Keeping his hand pressure against the cheek. Pull on the far leg to roll the victim toward on you on his side. Adjust the upper leg so that both on hip and knee are bent to the right angle. Tilt the head back to make sure that the airway remain open. If necessary, adjust the hand under the cheek to keep the head tilt and facing downward to allow liquid material to drain from the mouth. Check breathing normally. So the position is same like the picture. The sign of victim recover is patient is walking up, moving, open eye, and normal breathing. Then CPR in pediatric. First we check for danger, responsive, and shouting for help, airway, breathing, circulation, and defib. So danger, responsive, shouting for help is the same lah. We check for the airway using the same technique, head tilt and chin lift. Then do not push on the soft tissue under the chin, as this may block the airway. If you still have difficulty in opening the airway, try the jaw thrust method. Place the two fingers of each hand behind each side of the child mandible and push the jaw forward. Then for the breathing, keeping the airway open, look and listen and feel for normal breathing by putting your face close to the child's face and looking over the chest. Looking for the chest movement. Listen to the child's nose and mouth for breathing sound. Feel the air movement on the cheek. Look, listen and feel for not more than 10 seconds before deciding for CPR. If the child is breathing normally, turn the child into the recovery position. So if then send or go for help, call the emergency number and leave the child if not other way. Only leave the child if not other way to obtain help if possible. Check for continued normal breathing. If the breathing is not normal or absent, carefully remove any airway obstruction. Give 5 initial rescue breaths. Although rescue breaths are described here, it's common in healthcare person to have access to back mask device. While performing the rescue breath, note any gag or cough response to your action. This response or the action will form the part of your assessment of sign of life. So for the rescue breath, do the head tilt and chin lift position. Pinch the soft part of the nose with the index finger and thumb of your hand on his forehead. Open mouth but maintain the chin lift. Take a breath and place your lips around his mouth, make sure you have a good seal. Blow steadily into his mouth over 1 second, sufficient to make the chest rise visible. Maintaining healthy and chin lift, take your mouth away and watch for his chest to fall as air come out. Take another breath and repeat this sequence for more time. Identify effectiveness by seeing the child's chest has run and fallen in similar fashion to the movement produced by a normal breath. If you have difficulty achieving an effective breath, the airway may be obstructed. So open the child's mouth and remove any visible obstruction. Do not perform the blind finger sweep. It means don't put your finger inside the child's mouth lah. Ensure that there is adequate head tilt and chin lift, but also that the neck is not overextended. If the head tilt and chin lift has not been opened the airway, try the jaw thrust method. Make up to 5 attempts to achieve effective breath. If still unsuccessful, move to the chest compression. So for the circulation, look for the sign of life. There is include any movement, coughing, normal breathing. If you check the pulse, not more than 10 seconds, feel the carotid pulse in the neck or femoral pulse in the groin. If confident that you can detect sign of circulation within 10 seconds, continue rescue breathing. If necessary, until the child starts breathing effectively on his own. Reassess the child frequently. If there is no sign of life or the pulse rate is less than 60 beats per minute, start the chest compression, combine rescue breathing and chest compression. For all child, compression at the lower sternum area. So for the chest compression, located the sternum by finding the angle where this the lower rib join in the middle. Compress the sternum, one finger breath above the sternum. Place the heel one of the hand over the lower half of the sternum. Lift the finger to ensure the pressure is not applied over the chest rib. Avoid the compression over the abdomen area. Position yourself vertically above the victim chest and do with your arm straight, compress the sternum. Compression should be sufficient to depress the sternum at least 1/3 of the depth of the child's chest, which is approximately 5 cm from the child. Release the pressure completely and repeat at 100 to 120 per minute. 120 per minute. Allow the chest to return to its resting position before starting at the next compression. After 15 compression, tip the head, lift the chin, give 2 effective breaths. Continue compression and breathe in ratio 15:2 lah. Do the 15 time compression and give 2 breaths. In larger child, use the adult chest compression method. Continue resuscitation until the child has shown a sign of life, coughing movement and different pulse of greater than 60 beats per minute. Further qualification help arrive, you become exhausted. Then if patient showing sign of life, can put patient into the recovery patient. Place position should turn position into his side lah, return him to back safe. Take into consideration the possible if cervical spine injury. Ensure the airway is accessibility and easy observe. The adult recovery patient is suitable use in child. So the position is same as adult lah. Then CPR in infant. We do the same. Check the danger, any danger, and responsive. If infant, we check if baby is crying or not. Shout for help and airway lah. Then check for the breathing. Look for any chest movement. Listen at the nose. Listen at the nose and mouth for breathing sound. Feel the air movement. In the first few minutes of cardiac arrest, an infant may be taking infrequent noisy gaps. Do not confuse this with normal breathing. Look, listen, and feel for not more than 10 seconds before deciding. If you have any doubt whether breathing is normal, act as if it not normal lah. If the infant is breathing normally, turn infant to the recovery patient and call for help lah. Check for continued breathing. If breathing is not normal or absent, careful remove any airway obstruction. Give 5 initial rescue breath. Then while performing the rescue breath, not any gag or cough respond to your action. This response their action will form part of your assessment sign of life lah. Rescue breath for infant. Ensure the natural position of the head. As infant head is usually flat when supine, this may require some extension and apply chin lift. Take a breath and cover the mouth and nasal aperture of the infant with your mouth, making sure you have a good seal. If the nose and mouth cannot both be covered in the older infant, the rescuer may attempt to seal only the infant nose or mouth with his mouth. If the nose is used, close the lips to prevent the air escape. Blow sterility into the infant mouth and nose over 1 second, sufficient to make the chest rise visible. Maintain the head position and chin lift. Take your mouth away and watch for the chest to fall as air come out. Then if you have difficult achieving the effective breath, the airway may be obstructed. So open the mouth and remove any visible obstruction. As again, do not perform any blind finger swab. Ensure that there is adequate head and chin lift, but also the neck is not overextended. If head, tilt and chin lift has not opened the airway, try to for jaw thrust. Make for 5 attempts to achieve effective breath. If still unsuccessful, move to the chest compression. So for circulation, look for the sign of life. You can feel from the brachial pulse and femoral pulse. If confident that you can detect sign of circulation within 10 seconds, continue rescue breathing. Then turn into his position, recovery position. Then reassess frequently lah. If there is no sign of life until you certain that you can feel the definite pulse of greater than 60 beats per minute, start the chest compression. Combine rescue breathing and chest compression. Compress the sternum 1 finger breath above this. The compress should be sufficient. Depress the sternum at least 1/3 of the depth of the chest, which is approximate 4 cm. Release the pressure completely, then repeat at the rate 100 to 120 per minute. Allow the chest to return at the position. After 15 compression, take the head and lift the chin and give 2 effective breaths. Continue compression for 15 to set. So for the chest compression in infant, we can do 2 techniques lah. Tips 2 tips of the finger, or at the sternum, or the encircling technique. Place encircling technique is place the both thumb flat and side by side on the lower half of the sternum with the tip point toward the infant head, like picture number 2. Then put infant in recovery position. Place near the true lateral position as possible to enable to drain the fluid from the mouth. Ensure the position is stable. A small pillow or roll up blanket may be replaced behind the infant back to maintain the position. There should be no pressure on the chest that impairs the breathing. This should be possible to turn the infant onto his side and return him back easily and safely, taking into consideration the possibility of cervical spine injury. Ensure the airway is accessible and easily observed. Usually for the adult, the cause of the mainly cause is cardiac arrest like cardiac arrest So for the kids and child, it's usually due to airway obstruction like that. So that's why in adult we strictly do the chest compression, but in child and infant we give the breath first lah, and then we proceed to chest compression if there is no sign of life. Okay, thank you.
Okay, finish. For the audience, if there are any questions, you can ask the presenter. Okay, this one is just basically like to recap back what you've learned before. It's like your basic life support. The S for adults, for pediatric patients, for infants. Okay. So this one, I think the most important thing is that is to start your CPR early, especially if patient's already in hospital, then that will not be a problem. But this is, let's say, if patient got out of hospital cardiac arrest or OCA, out of hospital cardiac arrest. So it's important that the public, the bystanders, or if you are there, to start your CPR early. Because for every 1 minute you delay in starting your resuscitation, your CPR, you increase mortality by up to 10%. So if 10 minutes no CPR, patient is as good as dead lah. Okay. So now in this the time of pandemic, in this COVID, the most important thing is to wear adequate PPE. Because you know CPR is a aerosol generating procedure. Yeah, okay, it's a HEB procedure, so make sure you wear your mask, face shield. Okay. Then if you are let's say in a public space, okay, let's say you're out of the hospital, then if you want to proceed with CPR, you're not comfortable with doing mouth breathing, then just do chest compression would be good enough, at least. Okay, chest compression. So we highlight back the important points of high quality good CPR. One is to minimize interruption. Then the rate 100 to 120. Okay, compressions in a minute. And then at least 5 centimeters. Okay. And the other one is here a few things was not mentioned. One is you have to make sure no excessive ventilation in the hospital. Don't excessively back the patient while you're doing chest compression. Okay, because then you will inflate his stomach. Okay, and you increase the intrathoracic pressure. Okay, that you reduce sinus return to the heart. Okay, at the same time also risk of actually vomiting. Okay, then there is another term which is important. We call this as chest compression fraction. You have to maintain your chest compression fraction more than 80%. Okay, CCF more than 80%. Okay, what it means that 80% of your time throughout your resuscitation, you are doing chest compression. For example, if the patient, you're doing CPR for 10 minutes. So in the duration of 10 minutes, 8 minutes, 80%, 8 minutes is actually doing chest compression. Okay, so the other 2 minutes would be maybe you want to change your the person who's doing the chest compression, you want to give your rescue breath. So the most thing which they highlight is to maintain your chest compression until the return of spontaneous circulation or SC. So when do we stop our resuscitation, stop CPR? When once help arrive. If no help arrive, then you do until you are exhausted. Yeah, that's it. Okay. Okay. Again, is there any questions from the audience?
Audience ada lagi ke?
Yes, still have audience. Okay, if there's no questions, okay, I would like to thank both the presenter. Okay. And I think Dr. Farus will share this presentation to everyone. Okay, thank you both of you.